Men with chronic pelvic pain or prostatitis, this video is for you. Welcome back to Medical Made Easy. If you have been to a urologist and the pain is still there, maybe you have been prescribed some antibiotics for this. Maybe you have just been living with this for a long time. Do you know if it's ever going to go away? In this video, we are going to talk about the common causes of prostatitis and how to fix it. So be sure to watch the video as this is going to be valuable for you. The first thing you should know about chronic pelvic pain or prostatitis is that mostly when people see the urologist tests them for some sort of infection or a prostate infection or a sexually transmitted disease, and they will be prescribed antibiotics or steroids. Sometimes might start to get better in the beginning, but after some time, your body becomes resistant to antibiotics and doesn't feel symptoms getting better anymore. People get stuck in this negative loop of being prescribed antibiotics over and over again. Pain starts coming back and they get prescribed more antibiotics, and this cycle goes on and on. Many people are therefore unaware of the pelvic floor's involvement, if any, in any of these discomfort symptoms, and they simply become trapped within this hamster wheel. Is it because urologists fail to acknowledge the pelvic floor's role in the problem, or is it because so many people misunderstand it? That being said, a large portion of the medical establishment still doesn't acknowledge the pelvic floor's role in several of these diseases. Therefore, occasionally, it's a lack of education. Additionally, the pelvic floor's potential involvement in these symptoms is occasionally not entirely understood. Those who have seen a urologist and experienced something similar have been prescribed antibiotics, but they haven't been able to identify the cause of the discomfort. How can we determine whether the problem is connected to the pelvic floor? Pain often doesn't only happen to one person. Individuals with persistent pelvic or perineal discomfort may have pain in other regions as well, such as the penis or testicles. They might also have other urinary symptoms like pain with urination or urgency or frequency, and they might also have bowel issues like painful bowel movements or constipation or even frequent hemorrhoids. Is there a way for individuals to self-test for pain? In other words, how would they approach that assessment? People that experience pain often do so on continual basis. Thus, there is a constant generalized pain. However, individuals can also use their own senses, such as self-tasting or palpitation, to identify places of their bodies that, when squeezed, may potentially cause pain. Assume that you are feeling a little off. Begin by feeling all over the abdomen, the groin, the perineum, under the testicles, between the anus, the inner thighs, and the glutes are all potential sites for problems related to the discomfort that people experience when they have prostatitis or perineal pain. Alright, what should we do if we discover a painful point? First off, a little massage can be beneficial, much like it can for any sore muscle you may encounter. Massaging the perineum. Most people have perineal discomfort of some kind that they feel though as they are sitting on a golf ball. The space between testicles and anus feels constricted. Thus, using a tennis ball or lacrosse ball for a little perineal massage might be beneficial. For prostatitis, part of the programming also includes general flexibility, releasing tissues, and lengthening the tissues surrounding the hips and pelvis. Regarding persistent pelvic pain, are there any other tactics, resources, or advice that individuals should be aware of? Stress management is really important. An overactive pelvic floor is typically present in people with prostatitis or persistent pelvic discomfort. Consequently, they just spend their days feeling pain and clenched pelvic floor. Therefore, when a person presents symptoms, teaching them how to cope and control the stress that's occurring in their lives is really important. High stress, high anxiety, and overachiever type all often fit into this group. Thus, those who experience persistent pelvic pain are not elderly. In general, no. The younger population, those in their 20s, 30s, 40s, and perhaps even 50, is usually the most afflicted. Many people will experience severe agony for months or even years. People, therefore, occasionally just kind of suffer in quiet. They are the ones that had this experience. There is a great deal of guilt attached to it. Individuals are reluctant to discuss it with friends or peers. People so spend a lot of time searching online or just suffering and being silent. The most common example is just performing Kegel exercises repeatedly. Many would say, maybe I just need to strengthen my pelvic floor because it's been 2 weeks. After that, all they'll do is perform 1,000 Kegel exercises every day, and that will make all of the prostatitis symptoms they are currently experiencing much worse. What, therefore, should they be doing in its place? Learning simple relaxation strategies such as yoga or meditation, or doing a lot of pelvic floor patient breathing exercises to relieve tension in the pelvis are all important steps toward relaxing the pelvic floor. Work out like that every day, twice or even once a day. Let's aim for at least 2 times a day. Every 2 days, start in the morning and continue in the evening for a period of 6 to 8 weeks. We are hoping you will see the changes soon. In addition to basic mobility and flexibility, exercises to assist release tension in different body areas. So that's all for today's video, folks. Let us know in the comments if you have any feedback or any other question. Also, do not forget to subscribe, like, and share it with others who may need this one. Thank you, and until next time, bye-bye.